The World Health Organization says the monkeypox outbreak is not a global health emergency at this point, but they will continue to monitor the escalating spread of the virus. It's also, of course, being watched closely here in Canada, where there have now been more than 200 confirmed cases. I spoke with Chief Public Health Officer Dr. Theresa Tam, who has just been extended in that role, about monkeypox and the state of the COVID-19 pandemic. Dr. Tam, nice to see you again.
Very nice to be here.
I'm going to start with COVID because it's still here, although you maybe wouldn't know it if you're walking around in the world. Many of the restrictions are gone. Many mask mandates are eliminated across the country. And I'm wondering what your concerns are heading into the summer and maybe after the summer where people go back inside, and whether you are still worried about the rate of infection right now.
Yes, I think we all need to be prepared for the fact that the virus has not disappeared. I think in the summer months, generally speaking, the level of virus activity are lower, but I'm really watching some of the virus variants, the Omicron variants, BA4 and 5, which are on the increase. So we could still get some bumps in the summer, but what we really need to do is to make sure we're prepared for the fall. Just as people preparing to go back to school, we need to prepare for the fact that respiratory viruses in general goes up in the fall and winter period.
And I imagine that means then a conversation about boosters. The rate of boosters in the country is probably not as high as you would like it. I think it's around 55%. And we're now moving into a space where maybe fourth doses are needed for some parts of the population, maybe the whole population. What are your views around the need for boosters and how much more challenging it's going to be this time around to get people there?
The Canadian population has done really amazing for the first two doses, with I think 82% of people having, for the total population, that doesn't include, includes the kids too, 82% having had two doses. The third dose, as you said, is behind, mainly because some of the younger populations are not vaccinated. And I think as the fall moves closer, and Omicron is still with us, that third dose is really important. We know Omicron was a game changer. 2 doses is not enough to reduce infections. Luckily, I think the vaccine is still very good for protection against serious outcomes, but people really need the third dose to be better protected against this variant. And the variant itself is changing. So we are still watching very closely to see what the shift is in the virus, as well as getting people more up to date with the vaccination.
But for the issue around waning immunity, which is happening obviously across the population, does that mean that we are headed towards a situation where everyone will need another dose 1 or 2 times a year?
I can't say beyond this year, but that coming to the fall winter season, I believe, yes. I think we know activity is likely to increase. So boosters likely in the works for everyone, because it would be quite some time since the last dose for many. We know that well, we'll have to observe this continuously, but vaccine effectiveness against the most serious outcomes tend to be more sustained, even though that could wane over time. As the vaccine effectiveness against infection is highest when you first get your vaccine, and then it does wane over time to lower levels by 6 months, for example. So the National Advisory Committee on Immunization is set to give us some more instructions so that we know well ahead of that fall period what to do. But I think boosters are in the works.
I want to ask about long COVID. We had a conversation last week on this show about that, including speaking to a gentleman who has long COVID. And it does seem to be so much part of the unknown of this disease. And it is affecting the lives of lots of Canadians who feel that it's dragging for them. What are your concerns around how much we know about it and how we can best help people?
Yeah, so we do need to learn more about long COVID, and people use different definitions, but in general, it means people who have prolonged symptoms beyond 12 weeks or 3 months. And right now, there's so many different symptoms. It's really important to study them in more depth and to set up better studies, more high quality studies, in order to try and understand what the underlying pathology is, or the physiology of the illness. I suspect that we're dealing with a number of different underlying conditions. We do know that those who've been more seriously ill during the acute phase gets higher likelihood, higher risk of long COVID, but many people who had mild symptoms also seem to have prolonged symptoms as well. And we have not studied the basic biology in depth as yet. So that's why it's so difficult to pinpoint the prevalence or how many people have long COVID.
Yeah. I want to turn to monkeypox because that's kept you busy as well. What is the current situation in this in this country in terms of the outbreak? How would you characterize it? Because it does seem to be spreading, and how worried are you about that spread?
Well, we now have, I think today's update is 235 cases, and mainly in Quebec, and within that province, mainly in Montreal. And the other province that are more severely affected is Ontario, with 45 cases, mainly concentrated in Toronto. At this point in time, even though monkeypox virus can infect anyone who's susceptible in close contact with an infected individual, it is affected mostly gay, bisexual, or men who have sex with men. And we have not seen many cases that are outside of this community. So we have to do everything that we can to increase awareness and support that community in order for everyone to protect themselves and those around them and those whom they love. And that includes, of course, improving surveillance and case detection, as well as the laboratory testing capacity in Canada, which we expanded, as well as to offer now the vaccine, and in certain cases who are severely sick, some treatments.
We've seen now more vaccine clinics proactively opening up in Ottawa and Toronto and Montreal, and people going. You know, I think there's a real willingness to consider getting vaccinated for things, perhaps because of COVID. Do you foresee that the vaccination will have to be more widespread? What would lead us to that point?
Well, first of all, we've been communicating and engaging with community organizations, like 25, 29 of them, and there's been tremendous support from the community. So that's why I think we're seeing the uptake in vaccinations. And the vaccines are not there just to protect the individual, but really to protect others. We want to break the chains of transmission. And so that's what the objective is. And with more targeted vaccinations right now, we hope to do that. And we will see in a number of weeks. The other thing, so it is much more targeted. There's no need for a mass vaccination campaign, but we need to monitor the situation quite closely. The other thing is that globally or domestically, there just isn't a massive vaccine supply. The vaccine companies are looking at that. So we have to exercise very good stewardship of the limited doses that we have.
Okay. Dr. Tam, always good to speak with you. I appreciate the time.
Thank you so much.